Hello everyone, I'm Dr. Julia Perker and welcome back to the channel. Today we're having a crucial conversation, one that is often shrouded in myths and misunderstanding. Understanding female pleasure and the path to a better orgasm. My goal today is to give you, whether you're a woman or her partner, the precise medical knowledge you need to achieve genuine sexual satisfaction. It's time to normalize and prioritize female pleasure. Debunking the biggest myth, the orgasm gap. Let's address the elephant in the room, the orgasm gap. Studies consistently show that heterosexual women orgasm less frequently than men during partnered sex. Why? Because society has often focused on a single, ineffective model of sex. The biggest myth is the idea that penetrative sex alone is the gold standard for a woman's orgasm. The real star, clitoral anatomy. As a physician, I can tell you the main reason, the clitoris. The clitoris is not just a tiny external button. It's an extensive network of erectile tissue with over 80 nerve endings, making it the primary human organ dedicated solely to pleasure. Crucially, most of this structure, the bulbs and crus, is internal, surrounding the vagina and urethra. This means that to understand pleasure, we must move the focus from only the vagina to the entire vulva and the clitoral complex. The two pillars of climax for approximately 70 to 80% of women, the most reliable and direct path to orgasm is focused clitoral stimulation. This can be manual fingers, oral, or with a toy. Key tip: the glans tip of the clitoris is extremely sensitive, sometimes too sensitive for direct, strong contact. Most women prefer stimulation around the clitoral hood or nearby tissue, which provides indirect, pleasurable friction to the nerve endings. Visual aid suggestion: an anatomical diagram of the clitoris showing both external and internal parts. The deeper pathway, G-spot and blended orgasms. Now, let's talk about the infamous G-spot. Is it real? From an anatomical standpoint, the G-spot is likely the tissue corresponding to the internal part of the clitoris, the spongy erectile tissue called the urethral sponge, located along the anterior front wall of the vagina. How it feels: stimulation here, usually through deep pressure or a come-hither motion, can lead to a vaginal or blended orgasm, often described as deeper, more body, shaking, and sometimes accompanied by female ejaculation or squirting. Blended orgasm. For many, the most powerful climax is a blended orgasm, which involves stimulating both the clitoris and the internal structures simultaneously. The resolution: why one isn't better than the other. There is no superior type of orgasm. Whether it's a clitoral, vaginal, or blended orgasm, it is valid, healthy, and yours. The goal is pleasure, and the way you get there is unique to your body. Part 3, the mental and emotional blueprint. The brain is the biggest erogenous zone. We've covered the body. Now let's talk about the brain. You can have perfect physical stimulation, but if your mind isn't on board, orgasm is unlikely. The brain is your most powerful sexual organ. Key factors: safety, relaxation, and trust. Anxiety, stress from work, poor body image, or unresolved conflict with a partner are powerful inhibitors of arousal. The power of fantasy. Don't neglect your imagination. Engaging in fantasies, reading erotica, or using other forms of mental stimulation is key to psychological arousal and making the body ready for pleasure. Doctor's prescription. The 3 C's I recommend, focusing on 3 core areas to connect your mind and body. Communication. Ask for what you want. Don't wait for your partner to guess. Use clear, positive language like, "I really love it when you touch me right here, just like that." Context: set the scene. Rushing sex doesn't work for women. A comfortable environment, romantic lighting, or a long, intimate shower can change your mindset from stressed to sensual. Concentration. Practice mindfulness during sex. Stop observing your performance or worrying about your appearance. Focus intensely on the physical sensations you're feeling. Surrender to the moment. Solo exploration. Knowing yourself masturbation is essential sexual health education. You cannot effectively communicate to a partner what you need until you know yourself. Action step: dedicate time to exploring your body without the pressure of orgasm. Experiment with different pressures, rhythms, and techniques, fingers, hands, or a sex toy. Discover your personal pleasure map. This isn't about being selfish. It's about being informed and empowering yourself. Part 4: Actionable medical tips and resources improving physical readiness. Pelvic floor and lubrication. Two simple, often overlooked physical actions can significantly enhance pleasure. Schedule exercises. Strengthening the pelvic floor muscles, the muscles you use to stop the flow of urine, increases blood flow to the genitals, which enhances sensitivity and arousal. I recommend doing 10 sets of 10-second holds 3 times a day. Lubrication. Lube is not just for dryness, it's for pleasure. It reduces friction, intensifies sensation, and makes prolonged stimulation, especially clitoral, more comfortable. Always use a high-quality, body-safe lubricant. When to see a doctor's sexual distress and pain. As a doctor, I need to emphasize that if you are experiencing persistent difficulty, pain, or distress related to sex, please seek help. This is common and treatable. Causes to check for: hormonal imbalances, certain medications like S. for depression, chronic stress, or conditions like vaginismus or vulvodynia, chronic pelvic pain. Your healthcare provider can help identify and treat these underlying issues. A certified sex therapist or counselor can also be invaluable in addressing the psychological barriers. Female pleasure is a fundamental part of a woman's overall health and well-being. It's not something to be ignored, rushed, or treated as a bonus. It requires patience, open communication, and self-knowledge. Be kind to yourself and be informed. I hope this professional guide has empowered you. If you learned something new, please hit the like button, share this video with a friend or partner, and subscribe to Dr. Julia Perker. Your support helps me keep these vital conversations going. Question for the comments: what is the one thing you plan to try tonight to prioritize your own pleasure? Let me know below. I'll see you in the next video. Take care.